COVID-19 is on all of our minds. We wonder if our local healthcare providers are prepared to deal with the virus and provide treatment to the influx of patients. In the case of Salinas Valley Memorial Healthcare System, the answer is yes. Here to discuss how the entire system is prepared to help local residents during this time is Pete Delgado, President and CEO of Salinas Valley Memorial Healthcare System. This is Ask the Experts, a podcast by Salinas Valley Memorial Healthcare System. I'm Scott Webb. Pete, thanks so much for joining me today. I know how busy you are. First of all, how are things in Salinas and Monterey County right now compared to the rest of California and the country?
Well, Scott, I think we're doing very well right now. Our city leaders and county leaders have stepped up. They've done an excellent job advocating social distancing, implementing shelter-in-place policies, and closing schools and businesses. As a result, we've seen less overall positive COVID testings than we anticipate. The number of patients have been manageable. We continue to plan for the worst and hope for the best.
Well, you're so right. Preparation is key. So how does a health system like Salinas Valley Memorial Healthcare System prepare for a situation like one we've never experienced?
Our message is prepare. Don't panic. Let's take advantage of the time that we've had to prepare. And that's what we've done. We've doubled down on our training, our daily safety huddles, our reviewing our supplies twice a day. We've done a lot to help prepare the organization for the worst situation.
And so how is SVMHS supporting its healthcare providers and other staff who have to go to work every single day?
Besides the care for our patients, the number one priority here is the health of our staff. Without the staff, we can't respond to the community needs. So we've done a lot of work being transparent, working and informing our employees. The more informed our employees are, the more engaged. Our leaders have been very generous with their time, walking the hallways, answering questions with our staff. Many of our staff have been allowed to work from home. Those are basically the non-clinical staff. Our ER have set up tents outside to keep the patients from coming into the building unnecessarily. We've limited our visitations as well. All of those moves have makes our staff feel much more comfortable to do their work properly.
Yeah, it does sound like you're doing everything you can. What other assistance is out there for employees who just might feel overwhelmed during the pandemic?
It's important that we acknowledge those feelings. Our leaders understand the importance of supporting their teams. We make resources available, like employee assistance programs, sharing articles, videos, webinars that teach people how to deal with these stress. I really hope that businesses in our community are taking advantage of these types of programs to help their own staff deal with these difficult times.
What is the healthcare system doing, the entire system, and you oversee the entire system and a lot of employees, doing to support the community during the pandemic?
Constant communication and updates of what we've learned and sharing that with our community as often as we can, the facts about what's going on, supporting local businesses where we can. For example, many of our remote sites have trouble with getting food to them, so we've contracted some catering services so that that's our way of supporting the community as well. We've offered our patients the ability to see their doctors through telemedicine. And, it's important for the patients to stay connected with their physicians without having to expose them.
Yeah, there's no doubt that staying connected right now is key. We know that public engagement and volunteerism is at the core of SVMHS's commitment to the community. With all these events being halted due to social distancing, how has that affected the organization's efforts in these areas?
We are learning as we go, but we are learning how to take all this good work that we do in the community and putting them online, the community events, classes online. We are sponsors of the Blue Zone Project, and they haven't lost a beat. They just picked up and pivoted and are doing all their community organizations online. We need people to stay active and informed. So we're trying to reach them in new ways, and we're learning as we go. We're looking at deploying some of our staff to assist our community outreach and volunteers with less overall patient volume due to this virus. We have the capacity to focus on different things right now. So we're deploying some of our staff to the community. The census has gone down because of the elective surgeries going down, and as a result, we have staff that are currently, in some units, overstaffed. So we are readjusting, and instead of sending them home, we are using this resource in the community if the community needs them.
Really amazing to hear what you guys are doing, and isn't it amazing just how people can come together? Everybody has a job to do, and as you say, some people are just able to pivot in the moment and just do whatever needs to get done. It's really awesome to hear. So, Pete, what else do we want people to know right now about COVID-19, the response of the entire system that you oversee, community outreach, anything else we can tell people today?
It's important for our patients to focus on their health, or the community overall, to focus on their health. If you have some chronic illnesses, stay connected with your doctor. Don't forget about eating healthy, getting exercise when you can, maintaining your medications and treatment plans. Last but not least, I need to say thank you to every one of our team, our Salinas Valley Memorial Healthcare team. They've done an amazing job. Our physicians, our hospital workers, our volunteers, an amazing job.
That's so well said, and thanks so much for your time today, Pete. I know how busy you are. That's President and CEO of Salinas Valley Memorial Healthcare System, Pete Delgado. For more information on SVMHS, visit svmh.com. We hope you found this podcast to be helpful and informative. I'm Scott Webb. Thanks for listening, and stay well.